Hello, welcome. Good evening. How are you? We want to talk about preventing miscarriages. And I want you to know that preventing miscarriages requires a multifaceted approach, multidisciplinary approach, but we have to focus on the preconception before pregnancy. We want to focus on the pregnancy itself, and we want to focus on lifestyle modifications. So let's go into various ways that we can manage miscarriages. During the preconception period, it is very vital for you to take folic acid supplement, and it is recommended that it should be between 400 to 800 microgram per day. It is very, very vital. Preconception. Then number two is multivitamin with iron, then we have calcium, we have vitamin D. Then number three, you need healthy weight management. Your weight should be under control to prevent, we said it, that one of the causes of miscarriage is obesity. You need regular exercises, moderate intensity, not this rigorous style. You need stress reduction techniques like meditation, like yoga. They all, help out most of the times. Then apart from that, during the pregnancy, you need prenatal care and of course regular checkups and follow-ups. You need it. Then during pregnancy, the folic acid still continues. That's about 400 to 800 microgram per day. You need iron supplement as recommended by your doctor because of your own. We have various peculiarities. Avoid smoking or secondhand smoke. Secondhand smoke is when you are staying with me and I'm a smoker, you are not smoking, you should avoid me. Then, of course, limit your caffeine intake to about 200, less than 200 milligram per day. It is very important. Avoid lifting. Avoid heavy lifting and, of course, bending continuously. Then at times, if there's history of miscarriage, your doctor will recommend progesterone injections for you. Then, of course, on your own part, there's something we call lifestyle modifications. You understand? It helps because it's like preventive health. Number one, healthy diet is very, very important. Balanced whole food, including the carbohydrate, the protein, the vitamins, mineral salt, your water, your fat and oil. You have to stay hydrated. You need about 8 to 10 glasses of water per day. Avoid excessive heat like hot tubs, sauna, bath, and all that. It is not the time for you to just go in like that. Then manage your stress. We all go through stress. Even pregnancy itself is a stressor. Manage stress like using relaxation technique. Get enough sleep, minimum of 7 to 9 hours every night. Avoid environmental toxins like lead, mercury, asbestos, some environmental issues. Then, of course, if you have the medical conditions, they should, this time around, be properly managed. You should not hide anything for your doctor. If it is diabetes, it has to be managed properly. Hypertension has to be managed properly. You have to treat thyroid disorders. It is very important. If you have any thyroid issue, let your doctor know. If you have any autoimmune disease like lupus or something, it has to be addressed. Address autoimmune disease with your doctor. And if you have any infection like a urinary tract infection, sexually transmitted infection, monitor and manage infection. Let your doctors know. You don't need to hide anything for your doctors. It is very important for them to know. Then apart from that, risk factor, there's some risk factor that you need to discuss with your doctor or your healthcare provider for them to know how to properly manage you. Number one, if your age is 35 and above, you should, because it's a risk factor, you should be able to discuss with a doctor. Previous miscarriage or miscarriages. If there is family history of miscarriage, You understand? You have the history, heredity. Then chromosomal abnormality that you have, or maybe due to the other miscarriage that's happened is due to chromosomal abnormality. Let them know. If there is a problem with your uterus, uterine anomalies, let them know. Then supplement and nutrient. Number one, omega-3 fatty acid is very important for you. Vitamin E is a go-getter, it's good. Vitamin C is good. Then coenzyme Q10 is good, or whatever you want to take, let your doctor know. Probiotics are good for your gut. Then if you are feeling anyhow, when and how fast should you seek medical attention? Number one, any vaginal bleeding or spotting, severe abdominal pain with cramps, fever or chills in pregnancy, foul smelling discharge from your from your vagina, or you have signs of preterm labor. You understand, you are contracting when the time is not yet ready. And in many cases, I want you to know that the cause of miscarriage is not known. We call it idiopathic. They have tried all manners of things and they are not seeing the reason for that. And there are some of the things that you might not be able to prevent. Excuse me. Might not be able to prevent. However, there are various ways to lower your risk of miscarriage. Number one is not smoking or quit smoking during pregnancy. Not drinking alcohol or using illegal drugs during pregnancy. Not using drugs not prescribed for you by the doctor during the pregnancy. You have to eat a balanced diet with at least 5 portions of fruit and vegetable every day, because the way your carbohydrate will stay longer in your body, your fruit and mineral salts, your vitamins and mineral salts don't stay longer. They have short lifespan in your system. So don't try to make attempt to treat infection for yourself during pregnancy. Let your doctor know. If you have any infection like rubella, measles, that's German measles, let your doctor know. And you avoid certain food that you know that you are reacting during pregnancy, which could make you ill or even harm the baby. You understand? Then being a wealthy weight before getting pregnant is very, very important, because your weight obesity increases your risk of miscarriage. So you got to work on your weight. It's very, very important. And I want you to know that a person is obese when they have a body mass index, we call it BMI, of over 30. So you have to check up. If you are trying for a baby, before the baby comes, check up with your healthcare provider. Let them do the assessment for you to know if you need to shed some weight before you move on. You can check your BMI using the healthy weight calculator. You can talk to your healthcare provider or your midwife or your doctor or something. If you are pregnant, your midwife or doctor may be able to tell you your BMI, or if you are trying to get pregnant. And I want you to know the best way to protect your health and that of your baby's well-being is to lose weight before you become pregnant, to avoid stories that touches the heart. By reaching a healthy weight, you cut down all your most of the risk of you cut your risk of all the likely problems associated with obesity and concerning conception or pregnancy or all that. So you should be able to contact your GP for an advice. He or she will be able to let you know how to go about it to lose weight, maybe refer you to a dietitian, a nutritionist. They may be able to refer you to a specialist weight loss clinic. Then of course you should be able to practice safe sex. It's very important. Some sexually transmitted disease can lead to complications during pregnancy. So get tested before you try to get pregnant. If you're already pregnant, Get tested as soon as possible. During pregnancy, use barrier method properly in every sexual encounter if you are not sure, including oral or anal sex, to reduce your risk of uh, miscarriage. Treating any identified cause of miscarriage is very, very important. Sometimes the cause of miscarriage can be identified, and in these cases it is possible, but some it may not be possible to have treatment to prevent this causing any more damage. So you should be able to take care of yourself. Let your doctor know what you are going through, so that they will be able to treat you if you have any issue. And some drugs like aspirin, heparin has been used in the past to prevent blood clot, and they can improve your pregnancy outcome in women with antiphospholipid syndrome. If you have weakened cervix, your cervix can be, there is a stitch. This is the mouth of the cervix. They put a stitch, you understand, to prevent the neck of the cervix from opening, so that the neck of the womb from opening. We call it cervical incompetence, which can, just an operation, we call it sacrilege. And they just put a pulse string just to hold it like that. And of course, I've seen people carry the baby to term with that. It's usually done maybe 12 weeks after the first 12 weeks of the pregnancy, but most of the time they leave them on bed rest. It is very, very important in order to, prevent further complications of pregnancy or miscarriage or something. Take care of yourself. Whatever you're going through, this one will expire. Don't kill yourself. Don't have intention that you want to commit suicide. It's going to be better. See you in the next video. I'm your friend, Nurse Felicia. Bye bye.